Dr. Jim Malatras, to my immediate right, real doctor, Dr. Howard Zucker, to my left, Melissa DeRosa, Secretary to the Governor, to her left, Robert Mejica, Budget Director, calls himself Doctor of the Budget. He's not a real doctor. Today is 51 days since the first case in New York, just for perspective, so we know where we are. It's 92 days since the first case came to the United States of America. It was in Seattle and in California. These are the hospitalization numbers for today. Tick down from yesterday, but a slight tick, statistically irrelevant. The question for us is, are we past the apex? We have had a number of days that have seen a reduction. The reduction is across the board. Hospitals also say anecdotally that they have less patients in their emergency room, which, again, perspective, the emergency rooms were way over capacity. It was chaotic, it was hellish, and the emergency rooms are still at or over capacity, but it's better than it was. The total change in hospitalizations, you see that it's been going down. The 3-day average of hospitalizations is going down. Number of intubations is down again. That is great news. Not down as much as yesterday, but down. Number of new people
It's 23
coming in the
hours.
door with COVID diagnosis is, again, just about flat with yesterday. This was reporting over a weekend. Sometimes the weekend reporting can get a little funky because it's Saturday and Sunday, and they have less of a staff. The reporting may not be as accurate, but it's basically flat. The question that we initially dealt with at the beginning of this, as the numbers were going up, the question was how long until we reach the top of the mountain, right? Every day it was the numbers higher, the numbers higher, the numbers higher, the numbers higher. Question was, when do you get to the top? How high can it go? Then we get to the top turns out not to be a peak, it turns out to be a plateau, and then we're on the plateau and it's basically flat, and then the question was, how long are we going to be on this plateau? How long, how wide is the plateau? The question now is, assuming we're off the plateau and we're seeing a descent, which the numbers would suggest we're seeing a descent, the question is now, how long is the descent and how steep is the descent? And nobody knows. Just the way nobody knew how long the ascent was, nobody can tell you how long the descent is. And that's what we're trying to figure out. The number is coming down, but how fast does the number come down? And how fast does the number come down to where it becomes a low enough number that we have some confidence that we have a margin of error? Does it take 2 weeks for it to come down? Some projections say that. Does it take a month? Some projections say that. And again, the projections are nice, but I wouldn't bet the farm on them. And I don't even have a farm. Worst news is the number of lives lost. That number is still horrifically high. If you're looking for the optimist's view, it's not as bad as it was, but 478 New Yorkers died yesterday from this terrible virus. Everyone is anxious to reopen. Everyone is anxious to get back to work. So am I. The question is, what does that mean? How do we do it? When do we do it? Nobody disagrees that we want to get out of this situation. Nobody. You don't need protests to convince anyone in this country that we have to get back to work and we have to get the economy going and we have to get out of our homes. Nobody. The question is going to become how, when, how fast, and what do we mean in terms of reopening? With reopening, I want to set the bar higher, meaning the question shouldn't be when do we reopen and what do we reopen. The question should be, let's use this situation, this crisis, this time, to actually learn the lessons, value from the reflection, and let's reimagine what we want society to be. And since we are going to have to go through all of this, and it's not going to be fast, let's at least make this a moment that when we look back, we can say, wow, we went through hell, but look at all the lessons we learned, and look at how much better we made this place from this incident, right? We went through 9/11. We're hellish. Well, we had to rebuild. Yeah, but we were smart enough to say, how do we build back better? You look at downtown Manhattan now, it is better than it was before 9/11. You look at the security procedures that this nation has. We're better than we were before 9/11. We had Superstorm Sandy here on Long Island. Terrible, terrible. Thousands of people's homes gone. Long Island is better today for having gone through Superstorm Sandy. Okay, how do we use this situation and stop saying reopen, but reimagine and improve and build back better? And you can ask this question on any level. How do we have a better transportation system, a better housing system, better public safety system, better health system, better social equity, better use of technology? You have people who are working from home. A lot of them are saying, you know what, I should have been doing this all along. You have telemedicine that we've been very slow on. Why was everybody going to a doctor's office all that time? Why didn't you do it using technology? Why haven't we been using more technology for education? Why haven't we incorporated so many of these lessons? Well, because change is hard and people are slow. Now is the time to do it. And that's what we're doing in a multi-state regional coalition, and that's very important because that is the smartest way to do it. On a more granular level here in New York, we're going to have a reimagined task force that focuses primarily on downstate New York, which has been the most effective area, and led by the state with those local elected officials. But let's get the best housing experts. Let's get the best transportation experts. And let's use this as a moment to really plan change that we could normally never do unless you had this situation. In the meantime, do no harm, and this is my #1 concern every day. Do no harm. Don't let that infection rate go up, and that's testing, and that is watching the dial, right? We know what's going to happen now. The weather is going to warm. People are a little more relaxed because they see the numbers coming down, and we know human behavior, right? They want to get out of the house. They want to be more active. And there's a sanity quotient to this whole situation. There's only so long you can say to people, stay in the house and lock the door, right? They have to go out and do something, and they will. They will come out with a warmer weather, and we do have parks, and there are recreation areas. It's not even healthy to stay in the house all the time. But that is going to happen. That activity level is going to increase naturally. When that activity level increases, you can very well see that infection rate spread. Infection rate is primarily a function of contact. You touch a surface and then I touch a surface. You cough and the droplets go on me. It's contact. And that's why a place like New York City or anywhere you see a hotspot cluster, New Rochelle, it was about contact. People start coming out, they start moving around more, there will be more contact. That contact will increase the virus spread. Watch the dial, watch the virus contact spread. You'll see it in the hospitalization rate. To the extent we're doing testing, you'll see it in the testing rate. But remember how thin our margin of error. We were at 1.2, 1.3, 1.4. That's when the virus is outbreak. One person is infecting more than one additional person. When you get the infection rate below 1, theoretically, the virus is slowing. We're at 0.9. We have 0.9 to 1.2. That is a very fine margin of error. I don't even know that it's statistically relevant, frankly, because all of these numbers are a little loose. But that's what we have to watch, and we will. And we have to watch this until we have a medical treatment or we have a vaccine. That's when this is really over. In the meantime, I say again to my local government officials, I'm getting a lot of calls from a lot of supervisors, town elected officials, et cetera. They're under increasing political pressure, and they're wanting